How to understand how masks help prevent COVID-19. Frequently asked questions and answers. Method 3. What kind of mask to wear? 1. What kind of mask is the best? There are 3 main types of masks recommended to prevent the spread of COVID-19: cloth face coverings, surgical masks, and N95 respirators. All of these helps to prevent the spread of COVID-19, and any one of them can be worn in a public place to contain the droplets from your mouth. However, if you're not a healthcare professional, you should go for a non-medical cloth mask, and save the medical-grade masks for healthcare workers. Masks with exhalation valves or vents, like the ones used in woodworking, are not effective against the spread of COVID-19 since they release air into your surroundings. Cloth face masks should cover your nose and mouth completely without leaving any gaps on your chin or your cheeks. 2. Are N95 respirators recommended for coronavirus disease patients? No, N95 respirators should be saved for healthcare professionals. If you have coronavirus or you are caring for someone who does, you can wear a cloth face covering and continue to practice social distancing and hand washing whenever you can. If you are a healthcare professional, you should couple your N95 respirator with a clear face shield when you're working. 3. Where can I buy a mask? You can purchase a cloth face covering online from a large corporation, like Amazon, or from independent sellers, like on Etsy. If you're buying a face mask online, make sure it has at least 2 layers of fabric to be effective against the spread of COVID-19. Many companies and stores are now selling face masks, so you should be able to find them pretty easily. Target and Walmart carry them, for instance. 4. Can I make my own mask? Yes, you can make one out of a t-shirt or a bandana. If you're using a shirt, cut a 7 in 18 cm wide strip from the bottom of the shirt, then fold it in half lengthwise 2 times to make a long strip of fabric. Place rubber bands or hair ties on either end of the strip to use as ear loops. Fold the fabric over the hair ties, then put the mask on by grabbing it by the ear loops. To make one out of a bandana, follow the same steps, without the cutting part at the beginning. If you have a sewing machine, you can sew your own face mask out of 2 layers of fabric. 5. How do I put on and take off a mask? Wash your hands with soap and water first. Grab your mask by the straps or the ear loops, then hook the loops over your ears or the back of your head without touching the front of the mask. When it's time to take off your mask, grab it by the loops or the straps again and pull it away from your face, being sure not to touch the front of your mask. Then, wash your hands with soap and water. The front of the mask is the part that could be contaminated with COVID-19, which is why it's important to avoid that area. If you do accidentally touch the front of your mask, be sure to wash your hands right away. 6. Should I wash my mask? Yes, you should wash a cloth face mask after every use. Take it off and put it into a sealed bag until you can wash it. Then, put it into your washing machine and add detergent to run a cleaning cycle. You can let your mask air dry or put it into the dryer before wearing it again. Don't wash surgical or disposable masks, though. These are only designed for a single use. You can wash your face mask along with your other laundry since the hot water will kill any contamination on your mask. Try to wash your face mask at least once a day or after every use. 7. Can I reuse my mask? Yes, you can reuse a cloth mask until it looks wet, dirty, or ripped. If you are wearing a surgical mask, only use it one time before you throw it away, as these aren't meant to be reusable. If you need to throw away your mask, put it into a trash bin that's lined with a plastic bag as soon as possible to avoid contamination.